Good afternoon. Welcome to Evergreen Family Medicine's Facebook and YouTube pages for today's Evergreen Talks with Dr. Tim Powell. Evergreen Talks come on the second Thursday of every month at 4 o'clock, and we are live on Facebook and YouTube to answer your questions and present information from our physicians and providers and specialists in topics that matter to you. And this live format is meant for a Q&A. Today, we're going to talk about telehealth with Dr. Tim Powell. And as he describes things and talks through this process, you might have some questions that you want to ask. You can just enter them in the chat. And then at the end, we will look at those. And if they pertain to telehealth and haven't already been answered, we'll bring them up and have Dr. Powell answer those. If you'd like, you can also always visit evergreenfamilymedicine.com for more information about this topic and many others. But for now, turning it over to the CEO of Evergreen Family Medicine, Mr. Tim Powell, for today's presentation. Nice to see you, Dr. Powell.
Oh, hi, Brian. You know, today's town hall involves topics that I'm especially passionate about, and so it feels good to share them, frankly. So I'm going to get right to it. The most important measure, when it comes to healthcare can be summed up in one word, and it's access. And that's especially access to primary care. Now, you hear that word a lot, primary care. What I mean by that is pediatrics, family, internal medicine, mental health, and women's health, including obstetrics. Now, here's the deal. Evergreen Family Medicine offers all of those services, but offering just isn't enough. We need to make sure that it's actually available in a meaningful way, and there's some logistical challenges to that. First of all, Douglas County is a big county geographically, over 5,000 square miles, and it has a population around 115,000. As we move outward from a hub in Roseburg to more rural areas, what we find is more poverty, and with more poverty, we find transportation problems. That's an access problem. Parents who work have difficulty getting time off to take their children to the doctor, or even, frankly, to go to themselves. It costs money. Some patients are just not able to be transported. Maybe they live in a nursing home or assisted living or just homebound. And then so many medical problems present inconveniently after hours, weekends, when the clinic is closed. It's expensive to go to the emergency department. All of this hinders access. So that's the problem we got to solve here. Let's go to the next slide. Innovation. Innovation is one of Evergreen's core values, but there's a caveat. All improvement's going to require change, but not all change results in improvement. Let me illustrate that. Most of you have a smartphone. Think about communication, smartphones. Communication is quicker. It's easier with texting and electronic messaging, but understanding is not always improved. So I'm going to present to you Evergreen's vision of how telemedicine can improve access without sacrificing quality. Next slide. It's important to know what we're talking about, because most of our audience out there probably has had a telehealth visit or know somebody that did, and that provider used a tablet or a smartphone and they talked. There's some limitations inherent in that technology. That's not what I'm talking about today. Next slide. So I'm going to show you, first of all, telehealth. I guess I'll start in a school setting. And there's some essential components you're going to be seeing. There is the hardware. And the hardware that we use allows the video conferencing that I spoke of earlier, but also a physical exam. It's a physical exam equal to what I could do in person. We have electronic scopes. We can look at ears and throats. We have stethoscopes. We can listen to the lungs and the heart. We can take vital signs or special cameras to take pictures of the skin and really blow it up if we're looking at a mole or a rash. We can even do EKGs and ultrasounds, all remotely. Then there's the software. When I first started looking at telehealth and understanding how that could help us provide a solution for access, I was thinking I had to get the most cool hardware out there. Actually, The more sophisticated part comes in the software, because it allows scheduling from multiple locations to multiple locations, and then seamless integration into our medical record, and also multiple remote attendees. So the parents or a specialist can come in, and we can all be in a room talking. We have to have a space on both ends that's private and secure. For this particular entity, I'm talking about the schools now, we have a nurse on site who takes vitals and presents the patient and sets up the equipment. We have to have a provider in real time on the clinic side, and then we have to be able to do tests like strep test and COVID test and flu swabs and urines and pregnancy tests and so forth. And of course, the last part is communication with the parent. Now, I'm going to just move right on because you guys are tired of hearing me talk already. I just want to show you an example of what this looks, and we're going to go a short video to Cook County in Chicago. And Brian, play that video. And I hope you're hearing that. I'm not hearing any sound on my end. Can you text him and see it? Okay, I hope you guys heard that better than I did. There was no sound on my end. It was a young lady going to the school nurse.
The school nurse has on site. Everyone involved, the school nurse, student, doctor, and parent.
Okay, we're going to try it again. This time with sound.
A call from the school nurse can affect an entire day for you and your child. Now, with Cook Children's school-based telehealth program, it doesn't have to. When your child goes to the school nurse's office, if needed, they can connect virtually for a doctor visit to a Cook Children's board-certified pediatrician or certified nurse practitioner right from the school nurse's office. Here's how it works. Parents have the option of joining the virtual visit by logging into a secure website. The Cook Children's nurse practitioner or doctor will be able to listen to a child's heart, look into their ears and throat, and visually assess the child's other symptoms through specialized equipment the school nurse has on site. Everyone involved, the school nurse, student, doctor, and parent, can all communicate during the visit. If needed, electronic prescriptions can be sent to the family's preferred pharmacy.
So that's kind of cool. That's really cool. It certainly got my attention when I began to investigate this about 3 years ago. Let's show you another video. Let's go to the next one, slide 6. Now we're going to go to North Carolina. You'll hear the accents.
Kids who would otherwise not receive any care have access to care.
Take a deep breath. It doesn't require the kid to be out of class, because they can sit in class and wait for the prescription just like they could be sitting at CVS and wait for it. So we're able to get the teaching done at the same time with making sure that their health needs are taken care of.
I started school nursing itself 19 years ago. So 19 years ago, I would never have thought that we would be doing it quite this way. Oh, the kids love it. They're like, oh, this is cool. I can't wait to do that. Or that's so neat, especially if they get to see inside their ear, things like that. It's like, wow, I didn't know that. So they really like that. Okay, Luke, you're going to have to pack up and go home with strep positive, and we'll let mom know to come get you. Okay?
It's inexpensive. It's easy. It's a no-brainer in a lot of ways. And I would like to see healthy schools available to every kid in every school, at least in North Carolina, if not all over the country.
Thanks, Meredith.
Next slide there, Brian. So there's 46 schools in this county, and Evergreen hopes and plans to have a nurse and this technology available in every single school in Douglas County if it's desired there. These are some of the conditions we can treat. You can see those, and that's kind of most of the stuff your kid have. The other things we can do are like, well, child exams or sports physicals, treating minor injuries and doing immunizations, do some mental health counseling, drug and alcohol counseling. We can look for head lice, insect bites. We just do primary care. But let me give you an example of how this might be helpful in your school. You probably don't know this, but we have nearly 70 children now in Douglas County with type 1 diabetes, juvenile onset diabetes. That means they're on insulin pumps. Now, I can tell you the teacher and the secretary and the staff are very uncomfortable managing that student if there's a reaction or a difficulty of some kind. How valuable would it be to the school, to that student, if we could bring in one of our providers or even our pediatric endocrinologist to help manage that problem? Next slide. So here's I guess the core tenets of this: access, communication, and privacy. These are the cornerstones. If I added one thing to this, it would simply be consent. We cannot treat those children without parents' consent. And we, in each of the schools that we're in, it's on the school website, it's on our website, it's on the Facebook, where you can go get the forms to give consent, but we don't treat the kids without consent. Let's go to the next one. Now, if we were at another venue, and this is how it would look like in a nursing home, or we're also in the Roseburg Boys and Girls Club. And what you're seeing now is a wall-mounted kiosk. You can see it doesn't take up much room, and it can just be accessed when needed and locked up when it didn't. Here's a story. We intended to use these in the school. I really like this setup. It's very sturdy. It takes little room, and it was just really cool. But when I started then going to the school boards and talking to the superintendents and the principals, what I found out is, there's a problem with transporting kids between schools, even if you're just going from Yoncalla, maybe junior higher to Yoncalla Elementary. It's not very far, but there's concerns of liability. And so back to innovation, that first, or I guess second slide we saw, we work with a company called Vitalnet. And Vitalnet was founded by ex-military people, as mainly ex-Pentagon officers, who provided telemedicine in the military in that capacity. And so we told them our problem. They helped us develop a military-like suitcase, lightweight, which the nurses can just carry with them. So if the nurse is at the elementary school and Anita's at the high school, she just grabs the suitcase with everything encased in that and drives to the high school to see the student there. The next one there. So this is one of our chronic care nurses now, and this happens to be at Rosehaven Nursing Home. If you look real close up there in the corner, you're going to see me, the good-looking guy in the corner there, interacting with this lovely lady. During COVID, if one of our patients came to our clinic or to our urgent care, when they went back, they were required to go into isolation, and they would be in isolation for 10 days upon their return. I can't begin to tell you how difficult this was for seniors. And when we found this to be the case, we really weren't using a lot of our telehealth in the school because schools were all closed. So we said, okay, we're going to go to them. And we worked out that there was a lot of advantages beyond just a quarantine thing. The first advantage, of course, is that the patient doesn't need to be transported. That's no fun for the patient to be carted around like that. And even more important than that, the nurses that truly know the patient can be present for the exam when we do it in the nursing home setting. It allows those people that are caregivers that are actually seeing the patient every day to inform our provider, this is where the concerns lie. And it also allows our provider to have direct communication then with that care staff. And I will just tell you, that's incredibly powerful in directing care. Let's go to the next slide. So now we're going to talk about taking telehealth into the home. And I would say that every parent's been there. It's 11 o'clock in the evening, Saturday night, and your little one's sick. Do you drag that child out to the emergency department, or are you just going to worry all night? Well, there is another way to think about that. The next slide is a short video. And Brian, why don't you play that next slide video?
It's not coming up as a video, Dr. Tim.
Okay. Well, that's too bad. What it does is show this guy going in, checking on his young son there, and then pulling out a unit called Untitled Care, and looking at the ears and the throat, and they have the doctor on the other end. They listen to the heart and lungs, and they evaluate that child right there at home. Now, if you were to look, you can buy one of these units at Best Buy. It costs about $300. Unfortunately, that equipment is totally useless unless you can hook up with a provider on the other end to conduct the exam. And ideally, it really ought to be a provider who knows your health insurance and is available also if something goes wrong with a prescription or if follow-up is required. So let's go to the next one, where we are now. Where we are now, we're offering this service, Evergreen, in the nursing homes and also assisted living facilities in Douglas County to provide care for our Evergreen patient. It does require one of our nurses to be on location. They take the vitals, they hook up the patient to our device, they talk with the providers, the care providers there, and then they connect with the provider at Evergreen, and we do the exam. We're also in the schools. We're in the Glide school districts, all of the specific schools in Glide, the Winston Dillard School District and South Umpqua School Districts. We're also providing services at the Boys and Girls Club. In each of these cases, it also requires a nurse to be present and for parents to have been given permission for their kiddo to be seen. The intention then is to have this service available, as I mentioned, in every school in Douglas County. We're not offering yet home Untitled Care services. That was a bit of a tease, but we hope to offer this service as part of our direct care model in the future. And so I'm going to go to the next one, number 14 there, because that last comment was kind of a segue, really. I said a direct care model, and with good reason, you folks have no idea what I'm talking about. But this has ties to telehealth and also the evolution that Evergreen intends for primary care in the county. So I want to explain just a little bit. And I'm going to start, and this, I guess, is a question, next slide here. For the audience, what's important to you? What's important to you when you think of healthcare? When I speak with patients, this is the conclusions I have come to. First of all, they want the care to be affordable. Now, maybe you have an employer financed health plan, and if you do, good for you, or maybe you have government insurance that is paid for you, and you're blessed. But if you don't have one of those two things, and you're actually catching a sense of the actual expense of that, you're paying upwards to $20,000 a year in premiums to cover your whole family, and it probably has about a $1,500 deductible. That's not affordable. That's hardly insurance. Secondly, what patients want is they want access. They when they're sick, especially, they want to get in. They want to have confidence in the care, and it'd be great if it was actually convenient. So that's kind of what the patients wants. Next slide there. And then I say, well, what do the employers want? And I'll tell you why this is important, because if you're working for an employer, they're paying for it. They're paying for it, and they're paying the premiums, but most of those, or many of them at least, are self-insured, which means until you get to a place of what we call stop loss, they're paying. every healthcare cost. And what they are finding is about a 15 to 20% increase in insurance premiums every year. And that's insurance premiums for a high deductible. And so that's just a killer for business. And so they want stable or at least some manner of control or transparency and prediction for health insurance premiums. Secondly, I've found in talking with employers, they're very concerned that they have robust preventative care services. They want their employees to be happy with the health care that they're getting. And all of this is so that they have decreased employee absence from work. Plus, they like you. There's that as well. Now, number 17, what does Evergreen Family Medicine want? Evergreen wants to deliver a relevant primary care system, delivery system in Douglas County. We want an ability to innovate, and we don't want to be encumbered by the billing and coding requirements, which defines so much how we can deliver that service. There are so many metrics we're called to be accountable to. Every insurance, Medicare, the government, OHA, everybody wants to measure something about us. Here are the measures that we want to be accountable for: access, patient satisfaction, outcomes, and cost. If we can manage those, we're going to be very pleased with what we're delivering. And then where I started, we want to minimize the financial barriers to care. So that then is the primary motivation behind the direct primary care model. And so here we go. These are the basic tenets of a direct primary care model. And it is this: the employer pays a monthly stipend to, in this case, Evergreen, for primary care services. And in return, all primary care services to the employee, to the family, are free if they're obtained at Evergreen. Now, the patient can be seen elsewhere, and the usual deductible and the usual charges would apply, but in network, it's free. Here's why this works. This is why it can work. About 80 to 85% of total patient visits are with primary care. However, only about 3 to 5% of health care dollar spending goes to primary care. But primary care can greatly influence that other 95%. Now, under this plan, the specialist coverage and the pharmacy coverage and so forth is unchanged. Under this plan that we're speaking to right now, the covered care includes, well, all preventative care, illness, injury, anything that we can manage. But what it really does, and pay attention to this number 6 guy, it aligns incentives for the employer, the patient, and the provider so that we can deliver quality care in the most cost-efficient manner possible. Let's go to next slide there. So here are some of the things that we do, and you can look on this, and you're going to see that most everything you need during a year is going to be covered here. If you need your appendix out, you don't see it on that list. Open heart surgery, you don't see it on that list. But all of the primary care things you see there. Let's go to the next slide, Brian. And these are some things that aren't covered. Inpatient care, obstetrics, major surgery, and some of those things are not covered with under the free primary care thing. So what are the advantages? And as I said initially, each of these people, the patient, the employer, the primary care system wanted some things, and I've talked about what they wanted. How can this system begin to deliver this? Well, the advantage to the employee, I think, is pretty obvious. They get primary care, most of what they need, and it's free of charge to the employee and the family. They have 24/7 access. They have way decreased out-of-pocket expenses. They have the convenience of after-hours and telehealth care. And they have the peace of mind that comes from knowing that their family can access and they can afford health care. That's not a small thing for a family. And so the advantage to the employer, why on earth would they be willing to pay for this? Well, first of all, it's because you're really valuable to your employer. It's employee retention. And I believe that this can become one of the most valued benefits that an employer offers. It offers them stabilization and some predictability, some transparency for medical expense, because this is a value-based per member per month flat fee, and you can budget for that. There's no co-pays, there's no fees. And this part you may not quite understand unless you're the employer. There's no charge to the insurance. It isn't like we charge insurance and take what no, there's no charge. And the reason we don't is because when we charge your insurance, we're just charging your employer. They're paying that if they're self-insured. And so this is money they save. The payment to Evergreen is from the employer, but internally, if the employer said, you know what, I can't afford this for the whole family, I need the employee to contribute some to this plan, then that's between them, and it leaves us out of that. And there's a very integrated wellness program in this as well. And so for Evergreen, what are we getting out of it? It removes barriers, access, financial barriers, billing, coding, collections, requirements on how we engage the patient, all gone. Our job is just take care of the patient and do it in the most efficient, cost-effective manner possible. So, Brian, that's it. I want to thank everybody for joining us and just allow me to share some of what I guess Evergreen's been thinking about as we continue to innovate to offer healthcare to our county. This is the fun part for me. I've provided primary care for over 40 years. I understand where the potholes are, and I'm in a stage of my career now where I can begin to impact some of that, and it's fun.
Well, the direct primary care model is very interesting. And so we are in a spot now where we could take some questions from people if they are watching, and I know they are. So if you'd like to pop a question in here, go right ahead. But are there any employers in Douglas County right now that are offering the direct primary care model?
Well, funny you should ask, Brian. There's one, and it is Evergreen Family Medicine. We have about 300 employees, and like everybody else, we were seeing our premiums increase 15-20% every year. My brother John and I have talked a lot about this model over the years. We really believe in it. We would love to take a lot of the cost of billing and the going back and forth with claims and so forth out of this model. But it is unique. We understand that it's different from anything else in the marketplace. So we said, if there's going to be a guinea pig, it's going to be us. If we're going to prove proof of concept that it's more than an interesting concept, that it actually works, then we should do that. So this is the insurance product that we began offering our own employees and families as of January of 2020. Now, just to explain that a little bit better, we're self-insured. Okay. Pacific Source is our primary wraparound insurance, and this direct care model is embedded within that. And we just wanted to be careful where the edges were. We wanted to be careful of the data. We wanted to understand all parameters of this model before we begin to offer it to other Douglas County businesses. Our hope is that we can begin to offer this plan as of 2023.
So is this the debut publicly right now? Is that what just happened?
Well, I guess it is. I guess it is. I would love to have some interest. I'm not ready to offer, but I'd love to start talking with people about it. What we need to understand are some of the parameters, the cost and so forth involved. And I really want to have some data from our own experience that I can share with them. There's a question, how's it work so far? And we're still figuring that out. But I will tell you, it's working very well. COVID, of course, has been a great disruptor in healthcare, and there's been some huge claims because of that. It's not been a typical year. And then we also have to wait for at least a quarter and up to 6 months past the full year to get all the claims and the financial data from the last year. But our employees love it. Our employees like it very much. And the other thing, we've been able, because we're saving costs, we've been able to reduce the cost to our employees that's required to cover their whole family. And we've been able to reduce the deductible that they pay when they see the specialist or seen outside lab or whatever. Evergreen saves the cost of billing. So the employees get most of their care without personal expense, and our own insurance premiums for the first time in about 10 years stabilized this last year.
Is this similar to what they describe sometimes as concierge practice?
Yeah, you'll hear that that word concierge practice, and it is and it isn't. Concierge practice is intended to serve, frankly, mainly high-income people who in access buy access. They don't want to wait in line. They pay high monthly premiums, and in return, they get direct access to a doctor. And so that doctor has a small panel, maybe 500 people, to whom he's available all the time. And so they get highly personal care. Now, these insurances, or these practices really, don't bill insurance. Most of them, they don't bill insurance. Their focus is primarily on wellness and preventative care. And the range of services, frankly, is limited. Also, the patient is responsible for any care that's not provided by that doctor. So the patient does still need insurance. He needs a second insurance to cover the specialist and hospitalizations and surgery and diagnostics. What we're trying to do here is wrap that all together to ingrain primary care within a reputable insurance product. And we happen to really like Pacific Source. We think we can provide access using a usual provider panel size at an affordable price. So concierge practice for the masses, I guess. We also want, I said this before, but it's important to align incentives to save money, that we're in this together, because many businesses at least are self-insured, and that means they pay all the healthcare costs until the stop loss limit. So when we reduce total cost, we save that employer money. Because Evergreen has an advantage in this kind of a practice, most of the time the folks that do this are 1 or 2 person practice. We have over 40 providers, and we have an urgent care. So we have after hours and weekend care, and we follow our own patients into the hospital, and we can just offer a breadth of coverage that I don't think is available in any similar plan. So it's actually quite a bit different from a concierge practice. That's why I said it really hasn't been done before.
Well, you're going to trigger questions about this specifically, and it sounds like it's still very much in what we call the beta stage. But Linda Young has been watching from just about the beginning of the program and asks, where are the details for employers available, which could probably also be morphed into a question of, hey, when are you going to roll this out, or where can we find out more information about this in due time?
Yeah, I would love to talk to any employers that wish to, and I mentioned I don't want to get ahead of my skis here. I haven't gone out to employers yet because I wanted to show it works, and I really want to have hard data from a full year, and I don't have all the rest of last year because I need to know how to structure this and price, and also not to overpromise. I really don't want to do that. I believe I'm so passionate about this because it removes so much of the insurance company out of it. And it just gets down to the people that are paying the bills and getting the care and providing the care, which is great. So Linda, good question. And when I have the details, I will present them, but I'm probably going to primarily present this to employers because it's not really fair for me to go and sell it to all their employees and before I've described it to the employer, because he's the one that's going to be footing the bill.
Right. Well, let's shift back to telehealth, which was the first half of the program. And I apologize for the video glitch. I'm not sure what happened on that. We're live, and so technology, we get one shot at it as we go. very much like if we were doing this in a group, in a room with a projector, and suddenly it went a little bit.
Been there before, Brian.
Yeah, I think we all have, right? So the question is, will Evergreen see any patient in school-based health, and does it cost anything?
Okay, yes, to both. We will see any student, not only just any student. I've told the school, I'll see any employee, I'll see the janitor, I'll see the schools, the teachers, I'll see the principal, and I really think I can diminish need for substitutes then as well. We'll see anybody regardless of their insurance and regardless of their ability to pay or who their provider is. The one condition for students is that we need their consent of their parents to see that child, but other than that, we'll absolutely see them. Yep, we do bill insurance, just like they visit us in the urgent care. Obviously, we don't bother the child with any of those details. We just take care of them. If they're without insurance and the parents are interested and desirous to do this, we have community health workers that will really help them see what resources they're eligible for. If they qualify, maybe we can sign them up for the Oregon Health Plan, or there might be other financial assistance if they don't have insurance, but we will always provide care.
You mentioned nursing homes as well. So a question about that, will you see any patient in the nursing home or assisted living?
You know, Brian, that's different. And so that answer is no. In this setting, we're only seeing Evergreen patients. These folks, of course, are elderly. They're there for a reason, and it's really important we have the full information regarding all their history, their medications, recent diagnosis, any other data that might influence our decision making. So no, we're just but one of the real pleasures I've had in dealing with this is working with Rosehaven and Umpqua Health. They've been so cooperative in this. The directors there have, and as I went in there, I realized, I don't know how much time you have spent in a nursing home. Those caregivers work their tail off. I mean, it's not a thankless job because they are thanked in their own way, but these are really good people, and boy, do they work hard. And all they need is one more thing to do. So as we go in there, we're really making them understand this is value added. This is direct contact through the nurse we have there with our provider, where you have one number to call and you're connected and you'll get an answer back. And then the nurse will sit down with them, make sure they understand it, because so much is lost in indirect communication and a lot of errors. Sometimes a patient may go into the emergency room and they change some medicines. We didn't know that, and we assumed they were on the same stuff. And just so many, and that connection and communication is just priceless. So too often these people are kind of forgotten there, and they deserve dignity.
Mm-hmm. And then final question that we have right now is, what is Evergreen's vision for telemedicine in the school? And how does this complement each student just seeking their own provider?
Boy, I could talk a while for this. As far as seeing their own provider, this works great for some students and parents. They have the time and the access and transportation, and it just works fine and great. That we surely don't want to interfere with that, but it doesn't work for everybody. And so we're there if we're needed. I will say this: after 40 years, medicine above everything else is based on relationships. It's those relationships that build trust. So I have this dream for this telemedicine in school. We're going to have 2 providers and a nurse assigned to every school district in Douglas County. Now that team is going to make itself known to the students, to the staff, to the parents. We can hold clinics at appropriate time in the schools for like sports physicals or immunizations. Ideally, those providers can attend some of the athletic events in the event of injuries. I even want to develop an advisory board of providers, staff, parents, and students in every district. There's educational opportunities, both for maybe students interested in health careers, but also for our providers to engage students in the classroom when requested by the school. For example, maybe one of our nurse midwives might talk to the ladies in the 5th grade about menstruation, or a high school class about sexually transmitted diseases or contraception. And in the process of just being there, where it's at the game or in the school, there's a relationship that's nurtured. So even if whatever the topic is that day is not pertinent to the kiddo in the moment. Life happens, and maybe this issue or a similar one arises, and at that point in time, the student knows where I can go for help, and maybe think, that person wasn't that scary. I think I could talk to them.
Very good. Well, those are the questions that we have for you today. And once again, it's always great to hear you talking about some of the vision and the innovative work happening at Evergreen Family Medicine. So well done once again, and thank you for all your time.
Thanks, Brian, and thanks everybody out there that's listening. I appreciate it very much.
Well, you can find out more about this topic of telehealth, eventually direct primary care, I would think also at some point in the future, and more at evergreenfamilymedicine.com if you'd like more information. Plus, you can join us on the second Thursday of the month at 4 o'clock for Evergreen Talks. We'll be back a month from today for another topic that matters to you with our physicians and providers and specialists from Evergreen Family Medicine. So we hope you have a good afternoon. Continue to leave questions here if you'd like, or if you want to, reach out to your provider at Evergreen, or give a call to Evergreen and ask to talk to somebody about some of the topics that we've seen here today. And we'll let Dr. Tim get on with his afternoon, and we'll see you again in about a month for another Evergreen Talks. Thank you, Dr. Tim. We'll see you later.
Thanks, Brian. Good night.